Hello, and welcome to our fifth episode of COVID-19 Right Now, where we are gathering people from the Yale School of Public Health, alumni, faculty, friends, and talking about the latest issues with COVID-19. I'm James Hamblin. I'm a lecturer in the School of Public Health, and I am fortunate to be joined today by two colleagues, Jenny Pitzer, who's an associate professor of infectious disease epidemiology and focuses on vaccination, and Reza Yaesoubi, who's an assistant professor of health policy, and he's working on modeling. And I'm hoping that the two of them can help me have a better understanding of what the next few weeks and months and years might look like for us. Ultimately, but I wanted to throw first to each of them to hear just what's at the front of your mind today in terms of what you're noticing, what's missing from the conversation, what's keeping you up at night, and whoever would like to start, that would be great, because I don't want to put either of you on the spot right away.
I guess I'll go first.
Okay.
I think that one of the things that's kind of really been on my mind is trying to understand and get a grasp on kind of just how many infections are out there relative to the number of confirmed cases that we're seeing in the data. And we definitely know that the number of confirmed cases is a big underestimate of the total number of infections that are out there, both because there are asymptomatic infections that are occurring because not everyone is going to get a test, and even those who want to get a test often can't get them because of limitations in testing capacity and strict criteria around testing. And so just kind of getting a better handle on just how many infections are out there relative to the number of observed cases we've seen, I think is something that's really kind of interesting right now and would help us as modelers get a better grasp on kind of where we are in the epidemic and kind of how much transmission is occurring.
That makes me want to ask a follow-up though. What do you think of the numbers on early numbers you're seeing about antibody prevalence? Like it seemed to be very high in these preliminary numbers from New York. Which are you taking?
I mean, I think it's interesting. I've seen the numbers out of California, at least. I didn't see the latest numbers out of New York. I think what they were suggesting that there were 50 cases out there for every confirmed case, which sounds, pretty reasonable to me. But still, the overall kind of proportion of people infected was, less than 2% of the population, which suggests that we're a long way off from kind of any sort of herd immunity or anything like that kind of kicking in, which I think is very much true. I'm also, quite a bit skeptical of those numbers and think that they could potentially be an overestimate, just because I don't think we have a great handle yet on kind of how reliable those antibody tests are and whether in particular they could cross-react with antibodies to the other coronaviruses that are out there and infect people and cause common colds every year.
Yeah, I'll note that the Times push alert just 3 hours ago was 21% of people tested positive for coronavirus antibodies in New York.
I mean, that's a pretty huge number. So that's definitely, a large number. My guess is that that's an overestimate just based on cross-reactivity, but it's probably not, I don't know.
Okay, I know we're just throwing out there kind of various possibilities right now, but wanted to see if you had any immediate gut impulses. Okay. Sorry, Reza, firstly, what is at the top of front of your mind right now, and then also any reactions to what Jenny just said?
No, definitely. So I think, in this pandemic, we are facing with some challenging decisions. We see that with physical social distancing, the goal is, of course, to save to improve the population health, making sure that our healthcare system is not overwhelmed, and but at the same time we are hoping to save the economy, to not hurt the economy that much. So there's there are some challenging questions, I think, in the context of this pandemic, which require, striking a balance between how much we are willing to, invest and how much resources we are willing to sacrifice to improve the population health. And again, the social distancing is maybe one of the examples that you see, that there's some push to open everything. At the same time, there's push to, keep everything closed because we don't want to overwhelm the system. And then, what should we do? When would be a good time to reopen things? And if you reopen and then there's a rebound, when would be a good time to again close? And there's always costs and associated with all these decisions. And I think a lot of time all these consequences are not being taken into account when suddenly we decide, okay, now it's time to reopen things, or so that's the problem that I'm trying to work on, and that keeps me kind of awake at night.
Okay, yeah. People really want predictions right now, obviously, because the dire financial situations and job loss and just inability to feel like people can tolerate staying at home for too long. But I'm wondering how is it even possible to model things when we have the uncertainty of something like those antibodies, where you could, we're looking at an area where we might have 2% of people who were infected, or 20%. We don't think that's likely, but when you have that degree of variability, how is it possible to feel?
Yes, I think that's an excellent question. And I think that has been one of the main results in our preliminary analysis, that coming up with a nationwide policy about when to open everything up would not make much sense, because the state of the epidemic is very different across the states and across regions. And that makes it even more challenging, because you really need to customize your decision-making process for each of these, maybe at the country level, or at the, even state level. But yeah, there are a lot of uncertainties in our projections. But at the same time, the advantage of modeling, I mean, one of the advantages is that you can incorporate those uncertainty into your conclusions and your decisions, and at least make some informed decisions, recognizing that, yes, future is uncertain, and these are all possible scenarios that might happen, and there are some costs and health consequences associated with each. Now, how can I make the best choice, given what I know and where we are?
So are there obvious choices we should be making, either at a state or national level, that you see right now? Anything? I mean, I guess nothing's entirely obvious, but any big ones that you seem like we could actually make happen?
I think, a lot of the, maybe appropriate approach is to some extent intuitive, meaning that it really doesn't make sense to set a time that, okay, 2 weeks from now or 4 weeks from now, we are going to reopen everything. And the reason is, within the next 4 weeks, a lot might happen. That we might have new information, the epidemic might have a different turn. So what we know for now is that, so far, is that it makes sense really to look at your data, see the speed of the epidemic, how fast it is progressing, how many people are being affected, what are the societal costs of keeping everything closed, and then incorporate everything and take into account and make that decision to some extent in real time, instead of just saying, okay, I'm gonna relax everything 2 months from now. That doesn't make sense.
Yeah, you don't think they really have the capacity to make a prediction like that politicians should be standing on right now, right?
Exactly. Even both prediction and also a lot might happen. A lot might change. There might be newer studies. There might be, Anyway,
yeah.
So it's one of those situations that the speed of the speed of a spread is high. And at the same time, making bad decisions has more severe consequences compared to, for example, influenza. because of the high case fatality rate. So it's more important to both rely on the latest information and also make decision based on, what you have observed, and be a little bit more adaptive and responsive to what is going on.
Yeah. Does that sound right to you, Jenny? It sounds hard to argue with, but I
Yeah,
know
definitely. I mean, I think
want answers and time frames too.
Yeah, I mean, I think that, making predictions is always difficult to do, in part because it relies on making some assumptions about kind of, even with models, you have to make some assumptions about conditions either staying the same in the future or changing in some predictable way in the future. And given all of the uncertainties, for example, just in, human behavior and way people are reacting and the way politicians are reacting to things, you can't necessarily build in some of those things that are really, more difficult to predict into models. And so if you make a prediction now, sort of based on certain assumptions about things remaining the same over time and they change, I mean, obviously your model is potentially going to get it wrong going forward. And so I think that that's something that, people have been very critical about when it comes to some of the modeling approaches, but they just, it comes from a misunderstanding of kind of what the limitations are with models. And also I think what the purpose of the modeling is, and it's not always just to make predictions, but it's, a way of evaluating different interventions and different scenarios. So.
Yeah.
Yeah.
The question for you both is, as experts who've considered these scenarios in the past and thought about what, we should do and how they might play out, what is surprising you? What's been most surprising to you about the actual way things have gone in terms of trying to effectively create interventions and effectively model things? And anything here that I didn't expect that it would actually look like this when the time came?
I'm not sure anything has been necessarily too surprising so far. Only just in terms of the entire situation, I feel like this is something that we as modelers have been talking about and potentially preparing for in terms of these severe pandemic type of scenarios for many years. And to actually see something come along that fits that sort of, worst case scenario situation has been, I think, surprising and interesting. And it's also been interesting to see how much interest there has been in modeling, both from a, I think, positive standpoint, as well as potentially, drawing a lot of criticisms to the modeling. And so that's been kind of interesting and fun to see. But in terms of, how the short-term situations have played out, I mean, I think things have, not necessarily been that surprising to me.
Okay.
Yeah.
Reza, does that sound?
No, yeah, I agree. And I agree with Ginny that this is a situation that people have been predicting this situation for many years. And a lot of the papers that we wrote actually on same topic was published maybe many years ago, so we have been waiting for this day, not enthusiastically, but, that was just a matter of time. And, but yeah, I mean, the interesting thing about, or the maybe surprising thing about this particular pandemic is that it just, so many people are asymptomatic, and that makes it super challenging. And it just, I mean, I'm not a biologist or virologist, but I never thought that, we would see a pathogen that could survive on surface for such a long time, and that we have to, everything we want to bring to home, we have to sanitize. So these are, I think, it was a little bit from biological perspective, surprising aspect of the, and I was hoping that the government would be more prepared in responding, and that was also a little bit surprising.
How does it change the models to have a pathogen that lives for a long time on surfaces versus one that doesn't? I'm sure that's very complicated, but is there a way to say that it
is? I don't know. I'm not aware of any model that actually captured that. I don't know, Ginny, do you have any knowledge?
I mean, I don't think the models necessarily incorporate that per se. I mean, a lot of the models sort of make these kind of broad assumptions about how long people are infectious for and how many contacts they have. I mean, I think that one of the ways that that sort of plays into that is that it makes sort of trying to get a good estimate of kind of the number of contacts very, very difficult if a contact is defined by touching something that somebody, you know, may have touched 24 hours, 48 hours ago. And so, you know, I think it becomes very, very difficult in terms of how we measure contacts, how we sort of extrapolate from those to kind of predict out infectiousness, particularly in the more kind of detailed, like agent-based type models.
Yeah. Great. We talked a little bit last week about contact tracing, and in my understanding of where it has worked really well, it's been things like sexually transmitted diseases or diseases that require a specific type of contact, as opposed to diseases where you could have, basically you came into semi-close contact with almost anyone that could have been transmitted. Is there a precedent for modeling effective contact tracing and modeling a disease like that? Well, I mean, and you're combining with difficulty getting access to tests. So anyway, I'm wondering what the closest is.
Yeah, I think contact tracing and isolation and quarantine, or sort of isolation of cases and quarantine of contacts was very effective when it came to the first SARS virus back in 2003. But that was because kind of everybody who had the infection tended to have symptoms, and symptoms that were quite severe. And also people weren't really all that infectious until after they had symptoms, and often, you know, weren't most infectious until a week or so after they had symptoms. And so there it was much, you know, more manageable to control the infection and to do the contact tracing. Because even though if you weren't able to identify everybody who somebody came into contact with, at least you could identify enough of them that you could kind of get around it and limit transmission. And contact tracing was, you know, the way we ultimately eliminated smallpox way back in kind of the 1970s, when it was all about kind of ring vaccination, identifying a case and vaccinating all the people around that case. And so, I mean, I do think that contact tracing has been effective for, you know, a number of different infectious diseases in the past, but it does rely on being able to identify cases, which you can't really do if a lot of them are potentially asymptomatic. And, you know, it's definitely complicated by these things like virus living on surfaces and such.
Right.
Absolutely. Yeah. Yeah, I agree. And, you know, as Jeannie mentioned, for many infectious diseases, it has been a, you know, great strategy. I think to make it probably effective in this context, we need testing, as I'm sure everyone knows. I mean, if we can identify cases, then I'm not sure how effective contact tracing would be.
Yeah.
And we should remember again, you know, contact tracing is something expensive. You know, you have to, you know, hire a lot of people, and so.
I'm thinking that maybe it would be helpful to get kind of meta here in terms of the modeling. So it sounds like you both are very judicious and cautious about actually making predictions about when things could open or life could begin to seem normal again. Could we predict instead when you will be able to make such a prediction? As in, like, what level of testing, what information would make it possible for you to have a model that would be able to give people a relatively narrow time frame of what they could expect with decent confidence?
I mean, I think it all depends on kind of what the time frame is that you're hoping to make predictions on. And I do think that you can make reasonably decent sort of predictions on shorter timescales, just by having kind of a good handle on what the current situation is. And that, I think, relies on both having good testing and having consistent testing. So I think part of the difficulty now is just that the testing policies have kind of changed, and testing capacity has changed so much through time that it complicates the interpretation of a lot of the data that's out there. But if we could have kind of good, consistent, broad scale testing, even if you're not, identifying every case that's out there, you can at least kind of get a better handle on what transmission is today. And from that, sort of predict how many cases you're going to see, a week from now, or 2 weeks from now. And so I think that sort of prediction on that kind of time scale is very, achievable within the short term. I think making these kind of longer timescale predictions is going to be much more difficult. But having sort of sources of information, be it from antibody tests in terms of understanding kind of what fraction of people have been infected, also kind of what, fraction of kids have been infected, because that's been kind of a big source of uncertainty in terms of understanding why we don't see so many cases among children, and is that because they're not getting infected or because they're not showing symptoms? And I think those kinds of questions are going to require kind of additional data from multiple sources, not just sort of antibody testing, but kind of broader, testing of individuals within the population over timescales, as well as, a decent understanding of kind of behavior and policy going forward.
Yeah, and I agree. And a lot of time, we have kept everything closed, and people start seeing maybe a bend on, or the number of cases going down. A lot of you might misinterpret it that things are going back to normal. But in fact, as Ginny also said, it's very important to know actually how many people are still susceptible. Because if you turn everything on and go back to normal, and then there's a huge susceptible pool that can interact with maybe a small portion of infected people, then you have a rebound, and we are essentially negating every benefit that we have accumulated so far by keeping things closed. So I think it's important to know through testing and through maybe some other ways that how many people are still susceptible, and how many have maybe immunity, and before we can confidently say, okay, it's a good time to go back to normal.
Yeah, but
I'm sorry.
Yeah, I think that's definitely really important to know, but it's complicated by, the antibody tests don't necessarily tell you who has immunity, because we don't really know how to interpret those yet. And so I think it's going to require a lot more understanding. I think, that's going to come out over timescales of most likely months. I don't know.
I know a lot of people are asking me about the antibody testing right now, and you mentioned the issue of cross-reactivity, that people might be testing positive when what they had were antibodies to some other coronavirus or something that was causing the test to turn up positively. In fact, that person would not be immune. Are the models generally assuming, though, that if and when we have a test that finds coronavirus, COVID-19 or SARS-CoV-2 antibodies accurately and sensitively and specifically, that you would assume that person is very likely to be immune to and not susceptible? Or do you anticipate that there will be issues with quantity of antibodies or with subtypes of the virus that?
Yeah, that's how we interpret serological data is, I think always a challenge. And there's lots of infections out there that there isn't a good or correlate of immunity. So sort of the idea of there being a serological marker may indicate past infection, but doesn't necessarily indicate that somebody's immune to reinfection. And furthermore, it may indicate that they're immune to symptoms, but not necessarily to getting infected and spreading it asymptomatically, which obviously has important repercussions for kind of transmission within the population.
So you might carry it in your nasopharynx for a while but you don't develop symptoms, but you could still be spreading it through.
Yeah, I mean, I think there's lots of infections out there. I mean, I would say most infections that are out there are kind of imperfectly immunizing in some way, where you may have sort of been infected in the past and have some sort of serological evidence of past infection, but that doesn't limit you from, you know, potentially getting infected, probably being less infectious, but still contributing to transmission in some way.
Yeah. We have 2 audience questions here before we wrap up, if you don't mind.
Yep.
Do you have models that will forecast the public health impact due to the declining economy, e.g. unemployment and suicides, any other issues that we'd expect to arise as a result of unemployment and generally people being unable to work?
Yeah, I mean, I think that that's a very tough question. I'm not aware of any models yet that have sort of tried to take into account kind of the health knock-on effects of the economic impacts of COVID-19. But I do think that it is a potentially really interesting potential avenue of research and of modeling. I think it requires some, you know, slightly different type of methodology than what we used to model transmission of diseases. And of course it requires data. And unfortunately, a lot of the data is, you know, just coming out now and will kind of only be able to be realized, you know, in the future, because I don't think we've seen, you know, an economic situation quite this dire in, you know, a long time. But I do think that there are economists and others that are potentially out there who have kind of thought of these types of things, and you know, it's definitely a sort of interesting potential avenue of research for you know, a student or other researcher in the future.
Yeah. Yeah, no, this is to some extent, I know there was, for example, a study that they look at the societal cost of after Boston bombing, they decided to close the whole city. And then there was, of course, you know, because there's a cost of closing city, but that was for 1 or 2 days. But this one is more significant, and because of, you know, so it's a both interesting and important question if you want to make an informed decision about when to go back to normal, or, you know, how long you want to continue in this situation.
Do you think that option is really on the table, though? I mean, people talk about going back to normal, but even if you lifted every official recommendation and regulation, my sense is that here in New York City, people would not go back to restaurants, would not go to concerts, would not go to Broadway shows in a number that would make those institutions sustain. They would still go out of business. You know, the places operate with a 10% margin. They're very month to month, and so you could, even if you had most people going back to acting like they were normal, they don't have the disposable income and they have fear of contracting it or spreading it. So it just sounds sort of like a false option to me when people talk about reopening or going back.
Exactly. I mean, those people who are, you know, just want to go to a restaurant just because they're bored, they may not go because they don't feel safe. And even people who want to go make money because they need the money, those may not also choose to do that because they say, well, I'm going to make maybe $100 a day, but then if I get infected, you know, I might need to spend way more on the hospital costs and I might die. So for both, I guess, groups, until there is some, you know, reassurance that, okay, things are less risky, they may not, you know, go back to normal. As much as
I think a lot of that just depends on risk perception too, which I think is a very hard thing to gauge. And I imagine the situation in New York is probably quite different than the situation in, you know, the South, for example, where they are starting to talk about reopening, and there have been fewer cases up till now, even though it's like probably just beginning there and it's probably the worst time to be reopening. Like the risk perception is, you know, potentially lower than it is up here, and so people's behavior, I think, again, is potentially difficult to predict.
True. my sense, even purely from an economic standpoint right now, the people.
Yeah,
So
I do think it's going to be a slow return.
Out to the venues. They would not go to the shows. They would not go to the restaurant, even if they thought it was entirely safe. Too many people don't have the funds to do that, at least to the normal capacity they do now. So, in any case, I can get to the other listener's question, but I don't mean to pose a false option here. The other is, how do you feel about Cuomo's briefings where he shows daily that New York seems to be past the apex? Do you think that's accurate? Do you think that's the right message for him to send right now?
I think it's definitely, accurate. But the reason, I think that what needs to be clear is that the reason why that peak has happened, that the cases are coming down, is because the social distancing measures that were put into place have actually worked. It's not because we've sort of reached any sort of herd immunity kind of threshold that is causing the epidemic to turn over naturally. It's because we reacted and did something. And so it's important to know that this sort of severe level of restrictions that have been put on everyone's movement and people's kind of daily behavior are actually able to reverse the trend in the number of cases and to bring that down. That doesn't mean that we can go back to normal anytime soon. It just means that things that, the actions that we took have actually worked. Kind of what we need to do to maintain that and to keep it down, I think is going to be the next big question on everyone's mind.
Right. They talk about it in those conferences and stuff like as if it were a hurricane and we're past us now or something, but that's not at all the appropriate way to think about it, right? Yeah.
I think it's fair to say that they're past the worst for now in New York, but,
right, but it's a sort of hurricane.
There may be another hurricane, in the Atlantic, to go with that analogy.
Right. If you go back out, the hurricane comes back to you. Not, yeah. So, sorry, Reza, did you want to?
No, absolutely. That's the point that, a lot of people are making, that, don't be mistaken by just the slow decline in cases. There are many people who can get infected as soon as we start going back to normal and contact at the same rate. So it's just, we need to be careful that what we see is over the period that things were calm and people were inside the house and all people following the guidelines. So yeah.
Can we end on maybe a note of hope? In any direction that you see anything that you think, I think we've been a little rightfully kind of bleak here and don't have concrete answers that I know people want, and I don't want to give them false answers, but there's some hope to be had somewhere and something you're seeing in your work.
I definitely think there's hope in the fact that the social distancing measures have worked to reverse the trend and to bring the epidemic down. I don't think that this is going to have to be this way forever. I think there's also hope in the fact that, we've seen environmental impacts of this that are positive in some ways. Whether or not they can be sustained is, of course, is another story. But I think that it's going to change our way of life in some ways, kind of long into the future, and hopefully we can get good things out of that as well.
Yeah, I agree. I think we should be a kind of maybe a learning moment for everyone, and also, we always have things in mind that if I have time, I'm gonna learn this new things, or I'm gonna, so I'm pick a new hobby, and this is maybe the time that a lot of people they're always stuck at home. Maybe they can pick a new skills, learn programming or coding. I don't know.
Have you picked up a hobby?
No, I have. No, not really, because we just juggle between,
I don't think we have much free time right now.
really someone is, unfortunately unemployed, maybe it's time to pick up new skills for the time that when things go back to normal. I don't know. I'm just saying that we should take advantage of every hardship, maybe.
Yeah. Well, thank you both for joining. We should wrap there, but thank you, and thank you for the work that you're doing.
Thank you.
Yeah, thank you.
All right. Thank you, everyone for watching. We'll be back next week.